All right, it gives me great pleasure to introduce Betty Schorry, who's already everyone knows here, but what you may not know, we got another what you may not know. So Betty's a good Midwesterner, right? She's Big Blue. She's a University of Michigan grad, and then she's been in Cincinnati for a long time. And those of you who have had the opportunity to get to Cincinnati Clinic, you'll realize, especially if you have a child with orthopedic-related issues, you'll realize that she doesn't consider herself this, but the world's expert in orthopedic manifestations of NF1. And she gives all the credit to Al Crawford, who was her orthopedic colleague. But I'd have to say that I think Al learned more from you than you learned from him, at least in the NF field. But the last thing you need to know is that Betty's a beach person. Those of you who know Duck, North Carolina, and you can get by to visit her at her lovely home and called Cooper in Duck, North Carolina, you should make every effort to do so. So come on up, Betty.
Thank you, Dave. Dave knows all about the beach house because he's had the opportunity to share it. Okay, so I'm going to talk about some clinical trials for NF1 bone disease. And the first one I'm going to talk about is a trial that we have running currently through the NF consortium. There's a very long name for the study. It's called a study of INFUSE bone graft, recombinant human bone morphogenetic protein 2, absorbable collagen sponge, and the treatment of tibial pseudarthrosis in NF1. To make it short, we call it the BMP2 trial. These are the principal investigators of the trial. Dr. Viscachel is also involved in the trial, as well as a couple of our orthopedic colleagues. There are 14 sites in the NF Clinical Trials Consortium, and we've also recruited 5 Shriners Hospital sites to be able to recruit additional patients. So the problem we're addressing in this trial is tibial pseudarthrosis in NF1. So we know that about somewhere between 3 and 5% of patients with NF1 have a problem with the tibial bone in their lower leg, where it bows outward and is likely to fracture. It typically starts as just bowing of the tibia. You can see in the top slide there. And it's usually only one leg that's involved. It's extremely rare to have both legs involved. And sometimes the fibula, which is a smaller bone there, can be involved as well. The difficulty with this condition is about 2/3 of them will progress to fracture, and a fracture which is very difficult to heal. So standard casting, standard surgical techniques do not work well on healing this type of fracture because the bone is abnormal or dysplastic. So what we are using in this clinical trial is something called BMP2, or bone morphogenetic protein. And we know that there are a number of bone morphogenetic proteins that occur naturally. They play a role in bone development in an embryo. So they're present in very high levels while an embryo is forming. And they're very small amounts that we see in children and adult bones. And they play a role in fracture repair. BMP2 works to stimulate the progenitor cells for bone, so the cells that are going to become bone cells to differentiate into bone cells and results in formation of new bone. There is a recombinant form of BMP that's available now. It's in a product called INFUSE that's produced by Medtronic Laboratories. And this, the recombinant BMP2 is a really potent compound that enhances the process of bone formation. And orthopedic surgeons have been using it for quite some time now for things like spinal fusions and traumatic fractures, and have had a lot of success in improving bone healing with that. Many surgeons have already also been using BMP on patients with NF, particularly for NF pseudarthrosis, and sometimes for scoliosis surgeries as well. But that has been done on what's called an off-label use without any documented, well-controlled clinical trials showing whether it's more effective than not using it. And so we designed this clinical trial so that we would be the first really well scientifically controlled study to evaluate whether BMP2 is efficacious in helping heal the pseudarthrosis in NF1. So we've been recruiting patients between ages 2 and 18 years who have NF1 and tibial pseudarthrosis. We're recruiting them from NF centers and orthopedic centers, but really from all over the country. Anybody who is interested and potentially eligible for the study can contact us. And But the child must be recruited at the time when they're having surgery or when they're needing surgery. So they have to be recruited at the time of their first or their second surgery for tibial pseudoarthrosis. They can travel from other centers. There is travel money available. Recruitment, when we first started this study, we expected recruitment was going to be our biggest challenge, and it has been that way because this is a rare complication of a rare disorder. So there's very, very small numbers of children that have tibial pseudoarthrosis and NF and are right at the time when they need to have a surgery. The initial design of the study, we needed a total of 50 patients. We needed 25 patients to be treated with BMP and 25 to be in the control group that got the standard surgery without BMP. The standard surgical protocol that we use, the surgeons go in and remove the pseudoarthrosis area of the bone. They place a metal rod in the bone that's called a Williams-type rod. And they also usually take a small amount of bone graft from the child's hip and add that. They sprinkle that into the site where the healing bone is going to be. And then in our study, 50% of the patients are randomly allocated to whether they, in addition, get the infused bone graft. So and this is what infused bone graft looks like. It comes in a box. It's a protein that is sprinkled onto a little collagen sponge. And you may be able to see the little white collagen sponge there at surgery is then wrapped around the bones after they've been nicely resected and lined up. The sponge is wrapped around it, and it allows the BMP to diffuse into that whole area and help with the healing of the bone. The surgeons then close up the wound and apply a cast and wait for healing to happen. We've used a standardized measure to determine whether this is really working or not. By using something called the RUST score. And it's really important with trials like this to have a very objective measure of healing, because a lot of times if you ask a surgeon whether the bone is healed, they say, yeah, 100% of my patients, their bones have healed. If you ask the radiologist, they read it differently when they read the x-rays. So we really wanted to come up with a standard measure. So we are using this measure that's called the RUST score, where we have a group of 4 radiologists who look at the x-rays of the patients. They measure each side of the bone in the x-ray in terms of whether there's a fracture line, whether there's the callus, which is the healing formation of on the bone, or whether the bone seems to have completely healed at that point. So you can have a score of 1 to 3 on each of the 4 edges of bone that they look at, so a total score ranging from 4 to 12. So that's the measure that we're using to look at whether the bones have healed, this RUST score, and are comparing between the BMP group and the group that did not get BMP. So these are just showing some of the x-rays that we look at and how they apply the scores in 2 different views of the leg, looking at the bone there and the tibia. So the progress to date has been, unfortunately, very slow. We've only enrolled 2 patients since we first started recruitment in the summer of 2017 with an initial goal of 50 patients. And we knew this was going to be a problem because of how rare the condition is. But we also found, interestingly, that some patients were declining because they had a strong preference for one arm of the study or the other. We had some who already knew they really wanted their child to have BMP. They had read about it. They wanted to get that treatment, and they didn't want to run the risk of being randomized and have a 50% chance of not receiving that treatment. There were others who said, I don't want my child to have an experimental treatment, therefore I don't want to be in the trial. There were actually also a couple of who chose amputation as the initial treatment because they had been advised that it might be fewer surgeries in the long run, and many children do well with a prosthesis. So because of the very slow recruitment, we're revising this study to allow what's called parental choice. So, and we'll be talking some more about this in the next little session, but we're allowing the parents to choose whether they want their child to go on the BMP arm or the control arm of the study, or whether they want to just be randomized. And we think that goal will significantly increase our number of patients that we can get in the study. So the next I want to talk about just briefly is a vitamin D trial that Dr. Viscaccio here is running. There are 3 participating centers at Utah, Cincinnati, and Vancouver, and that this study is currently ongoing. The reasons for having this study is because we know that many patients with NF1 have low vitamin D levels in blood, and this includes both children and adults. The cause isn't well understood yet. But we know it may contribute to bone problems such as osteopenia or osteoporosis, and may contribute to fractures as well. So the goal in this study was to look at vitamin D insufficiency in young adults who have NF1 and determine the best dose of vitamin D to use. So this study is currently enrolling. We're enrolling young adults between ages 25 and 40. They have to have vitamin D levels within a certain range, between 9 and 29. That's considered in the insufficient range. We don't want patients with severe vitamin D deficiency or who have normal vitamin D levels. But interestingly, we're finding at least 80% of our patients that we test fall into this insufficient range. And then they're randomly assigned to 2 different doses of vitamin D. Everybody gets vitamin D, but it's 2 different doses. And they're followed over 2 years with DEXA scans and vitamin D levels. So the goal is to, first of all, to determine what's the best dose of vitamin D for young adults with NF1 who are vitamin D insufficient, but also to collect data on bone health and bone density and how that is affected by vitamin D. So those are our bone trials that are ongoing now. I'll be glad to take questions, and I'll be talking a little bit more in the next comparative effectiveness session about that. Any questions?
I know that there's how rare PA is, an NF. Well, I'm one of the people that's even more aware. I've got an ulnar PA, and one thing that maybe you're already aware of, this is maybe a way to recruit more people, is that there is a Facebook page called, I don't know if you knew about that, it's called Congenital where they say pseudo, and as we all know, it's pseudoarthrosis support group, and there are lots of people on that page, so maybe I can talk to you about that later.
I will look into that. I mean, we have been advertising we have information on the CTF website and we've used the NF registry.
Right, but this Facebook page, a lot of these people are off our radar.
Not all people with congenital pseudoarthrosis have NF, so we'd only want the ones with NF, but thank you. Any other comments or questions? Yes.
Go ahead.
Just a comment on recruitment. It's up to 40 years for vitamin D, but would you recommend taking vitamin D supplements to all patients? I mean, in general, because they may not get on the trial, but
yeah, that is something that actually was just addressed in the new guidelines for adults with NF. The data is not really strong yet, but there's enough concern about it that many people are recommending regular vitamin D supplements or checking vitamin D levels and supplementing when needed. Another question?
I have a
Oh, okay, we'll go over here first.
I have a question, or to tell you. My daughter, who's age 30 right now with NF1, she was diagnosed with osteoporosis at age 7. She had a compression fracture of her inner thoracic spine. They immediately put her on biophosphonates. Mm-hmm. Well, I wouldn't say that. No, they delayed. They used the nasal spray for a long time because they were concerned about childbirth and biophosphonates and all. So eventually they put her on biophosphonates. She was on them for years, and she didn't get any benefit from it. Then she did 2 years of Forteo, and still no benefit from those injections. We are supplementing with vitamin D. I have been chronically low with vitamin D, being a redhead, and sunscreen and all. So I give her 5,000 IU a day to maintain her vitamin D levels. But ironically, ever since age 7, when she had those first compression fractures, she's never had a broken bone. And she's fallen many times, and I think having the vitamin D supplementation may be kind of protecting her bones, although her T-score is minus 4.9. So we kind of don't know what to do, and her orthopedic bone health doctor at Children's in DC, she says, well, just keep doing what we're doing. But it's an interesting point. Also with the vitamin D, from myself and her, having taken the vitamin D, we found there's a protectant, and she rarely gets a cold. She doesn't get sick, and very rarely do I either. So I think there's a lot to vitamin D. I'm a big proponent.
And I think it's interesting to comment about the bisphosphonates, because there's also some animal research that looks like animals, the mouse models with NF1 may not respond that well to bisphosphonates either, so we really need to start looking at some other lines of drugs that may be more effective for the osteoporosis. Yes?
Yeah, I have osteoporosis. I've had it from a young age, and I've had low vitamin D, so I take a lot of vitamin D. And I was just wondering, on your study, how come you stop it at age 40 and not do it for the rest of us that are older?
Well, Dr. Viscaccio can address that, but the reason was we wanted an initial study of an easy population to study, and one where we didn't have effects of menopause on bone and things like that yet. I mean, studies in older adults will need to be next, but this was just an initial study.
I'm just gonna have a quick comment about vitamin D. Get it monitored by your doctor. Our son was taking additional vitamin D. It is now, he has too much and is affecting his parathyroid. So make sure you're getting it monitored. I also have another friend in Chicago. Her daughter with NF was taking supplement, actually was again taking too much and ended up being hospitalized and having some kidney and liver issues. So there's a lot of talk in all these NF groups about vitamin D, but make sure it's monitored because you can have too much. So that's my cautionary tale.
Okay, thank you.